Okay, everyone. So in continuing with the GI tract diseases, today we're going to talk about Salmonella. So we're going to share the screen here. Salmonella is a disease that affects, a wide number of animals, not just, I'm sure you have heard of this disease. It affects humans. It affects a lot of animals, okay? It can either cause enteric or systemic disease. So enteric disease means diarrhea. Or systemic disease, sometimes it can cause abortion, it can cause septicemia, etc. Okay? We have two species of Salmonella, Salmonella enterica and Bongori. These two species are the only species of Salmonella. And then, however, Salmonella is so different. It's so different than pretty much anything that we know. I guess the other one that can be also similar would be leptospirosis, which also has a ton of subspecies, okay? So the Salmonella enterica, which is the one that we are going to be talking about, has 6 subspecies and 2,000 serovars. Serovars is division within the subspecies, okay? So there is about 2,000 different Salmonella that we are going to, to differentiate. The great majority of them cause the exact same things. Some of them are more virulent than others. They're mobile, so they go places, and they are facultative and aerobic. Facultative and aerobic is an individual, a bacteria that it can live in the presence of oxygen, but if there isn't oxygen, they can also live in the absence of oxygen. So it's a type of bacteria that survives in many different types of environments, okay? The enterica causes disease in warm-blooded animals, and the Bongori causes disease in the cold-blooded reptile type of animals. The other thing about Salmonella is that it can be host-adapted or non-host adapted. The one that generally causes more diseases that we hear about is the non-host adapted. Okay, for example, when people go to a wedding and a bunch of people get sick with Salmonella, generally it's the non-host adapted because that is the one that causes diarrhea. Okay, so we have diarrhea, typhoid fever, paratyphoid fever, or the ones that only cause diarrhea. The host adapted, like I said, serovars are going to cause systemic infections. And in the case of horses, the serovar abortus equus, so it's called Salmonella. Hold on just a second. Salmonella, because like I said, the enterica has 6 subspecies, 2,000 serovars. So it's going to be called Salmonella enterica abortus equi. Okay, so that's how long that name is, which is different than a lot of the other agents that we know. And it is not present in the United States, but in this case, it's host adapted, and it causes abortion in horses. So host adapted meaning it only causes disease in that particular species. And then non-host adapted Salmonella, which is what generally we get sick with diarrhea, is going to generally produce colitis and diarrhea. It can also cause systemic disease in case the clinical course of the disease becomes so severe that the Salmonella gains entry to the blood circulation and spreads disease everywhere. It can be more problematic in young animals than adults. Source of infection is difficult to identify because, if it was the feed, if it was, the hands of people, a lot of these things have already been cleaned, the feed has already been consumed, so we just know that, the horse has Salmonella, and so on and so forth. The route of infection is the fecal-oral route. That's important. So at some point, somebody, horses or people, etc., are going to be eating feces. Now, feces that come from who? That's the question, okay? So water, feed, feces, worker-contaminated hands, etc. So that's the route of infection, is fecal-oral route. Salmonella can be a problem in hospitals, okay? So a horse goes to a hospital for, I don't know, something else, lameness surgery, and then because there is this conglomeration of horses in a hospital, and a lot of the times adult healthy horses can be shedding salmonella. Okay, so, and then you get a horse that is in the hospital for something else, and he's already a little bit immune compromised, and then he gets salmonella somehow because that stall wasn't disinfected ideally, and then this horse gets salmonella and then develops a disease as far as diarrhea and colitis go. So there is a problem in hospitals when we send horses to spend a while in the hospital. Horses, like I said, horses and cattle can shed the bacteria and infect other horses, and even though they're not even sick at the time. Horses shed more in summer than the winter. So hot temperatures, for some reason, I don't know if it's the stress, no one knows, or what, but horses shed more in the summer than in the winter. What else did I want to say? Well, talking about the fecal oral route, the fact that, and that's one of the reasons why we don't recommend that horses drink water from streams. And we're going to talk about Potomac horse fever also, and also Lawsonia. And that includes leptospira also. Because drinking water from streams, you never know what's upstream from you. So if there is a cattle farm or there's a hog farm and these animals went, and because cattle like to just drink from the stream and then they sit there for a while and they defecate in the stream, and then downstream from you, or downstream is you, and now your horses are drinking water that have cattle feces in them. Okay, and that becomes a problem because that particular time that the horse is drinking that water, that water can be contaminated with, I don't know, Salmonella, E. coli, Lawsonia, Leptospira, etc. Okay, so drinking from streams is never ideal. Okay, generally it's better to drink from city water because that water has been treated. Wells are okay too, as long as the well is well maintained and there is no way, and you test the water periodically to make sure that the well is not contaminated either, because from the well sometimes the soil can actually get into the well water and contaminate it also. Okay, Salmonella can persist in fecal matter in the environment for months or years. Feed. Okay, so commercial equine feeds are manufactured using GMP, which is good manufacturing procedures, but none of them are certified salmonella free. Okay, and up to about 40% of feeds concentrate are positive for salmonella. Okay, so we don't know. So what we do know is that this, mares can be fed these feeds and they have salmonella, and they may shed the bacteria, they may infect foals, and that may be something, but it may be also that the mares may just shed the bacteria, period. Remember I told you guys about rotavirus, how the mares don't shed the viruses, and I actually made mention that mares do shed salmonella and foals can actually get sick from that. Pelleted feed, because it's made in a heat kind of, the pellets need to be heated to be extruded, to be able to be formed into pellets, and that can destroy the salmonella, but it's not always, it needs to be at a certain temperature, etc. Now, if 40% of concentrate is positive for salmonella, does that mean all concentrates are problematic? Not really, because it's not every single foal in the United States that is going to have salmonella type diarrhea. Okay. Other sources of contamination of the feed, and this, I am strict about this, guys. Okay, so rodents and birds' feces are important. There is no need for birds or rodents in a barn. A barn is not a place for rodents or birds. Okay, and I cannot stress this enough. Okay, now it's harder for insects, but it's also your barn. If you have a clean barn and operate cleanliness protocols, you should have low number of insects also. But rodents and birds, I'll tell you what, they don't belong in a barn. Okay, so what do? I mean, you can put traps everywhere, but my go-to for rodents and birds, and you guys are going to know what I'm going to say, is cats. Okay, cats are awesome. Okay, because they maintain the environment of the barn really, really clean. So that's the other way that you can contaminate the feed. Pasture contamination, sometimes with organic fertilizers, or just depending on the type, some organic type of fertilizers that have bone meal in them or blood or etc. Can contaminate the pasture. Runoff from neighboring farms, contaminated water used in irrigation and sprinkling, etc. Okay, so in areas where we have floods, that area can become contaminated too. And I already talked about this. A horse can shed the bacteria without clinical signs. So sources of Salmonella to horses, as you can see, it can be anything. Ingestion of contaminated feed, contaminated hands that feed the horses, surfaces, okay, contact with livestock, mice and rodents and birds and insects, contaminated water, etc. The prevalence in, what is prevalence? How much Salmonella is out there? In the general equine population is not known. It's very difficult because the only way to learn the prevalence would be to go and test all these healthy horses and see if they're shedding the disease. And the truth is, a lot of them shed the disease, but who's going to pay money just so somebody can go and test horses to see if they're shedding the disease? The answer is no one. Here's important, the normal intestinal flora and motility. Okay, this, I want you guys to do a star beside this, okay? Because here's the thing, as the intestine moves with what we call peristalsis, which is the move from oral to aboral, so from the mouth to the anus, moving constantly, normally, that movement impedes the pathogenic microorganism to get contact with the villi and destroy the villi and gain access to the blood. So that movement and also the normal intestinal flora make animals more resistant to this pathogenic bacteria. So the movement, which is peristalsis, prevent this bacteria from gaining access to the villi of the intestinal wall and destroying them, and then gaining access to my dog just passed here, gaining access to the circulation, the blood circulation. So it's important. So that's why you can see how horses with colic, when their intestines are not moving perfectly, how that can become a problem, because it's more time that the bacteria has in contact with the gut. Okay. The other thing too is that the normal microflora, which, as you all know, all these bacteria, they are competing for food. Okay, everybody eats the same thing. So if you have an abundance of normal, healthy flora, they're going to compete against the pathogenic bacteria. And if you have less of them, and even though they're more virulent than the other ones, they are not going to allow this one to just flourish. Okay, so that is important for you guys to understand how the movement is important. Okay, and this is not just against Salmonella, it is other pathogenic bacteria as well. What are the risk factors for this disease? So foals, anything, okay, diarrhea-wise, foals are incredible and they get a lot of things. Stress, so transportation causes stress to horses. There is ample research that shows that putting a horse in a trailer and taking them to a show and just traveling with them, even if you just put them on a trailer, travel and then come back home, can lead to gastric ulceration. Okay, so that means that the horse has had a lot of stress during the transportation. Other risk factors, surgery, okay, because when you're in surgery, your GI doesn't move very well. You're in a hospital, which has outbreaks of Salmonella, etc. Any change in feed needs to be done gradually because you're going to change the flora, and any change in flora needs to be done gradually so one type of bacteria doesn't take over everything else. Antibiotics, obviously, because it kills a lot of bacteria also, and then it gives, if a certain bacteria is more resistant to that antibiotic, they can actually multiply when other good microflora has died. Colic, I just said the diminished motility can be a problem as well. Deworming, okay, because they're messing with the GI tract, and high environment temperatures such as summer, okay. The pathogenesis of this disease, and this is pretty much the same for us also, okay? It is transmitted by the fecal oral route, like I said. The infection is going to depend on bacterial load. This is important, guys, for everything. So when a person gets sick with influenza, the more sick, it also has to do with the viral load that they were in contact with. So some can become less sick as others, more sick, etc., because of the amount of viruses that they got in contact with. The same goes for Salmonella and other bacteria. The bacterial load, if you ingest 1 little bacterium, it's probably not going to cause any disease. If you ingest 1 billion bacteria, it is going to cause disease. But if you ingest 100 billion bacteria, then definitely your disease is going to be more severe than the one that has ingested just, a billion or whatnot. The Salmonella is going to invade the intestinal epithelial cells. Okay, they go inside the cell as well. There's going to be a large inflammatory response that's going to happen. A large inflammatory. So neutrophils are going to be recruited to the area. There's going to be epithelial cell destruction and loss of epithelial barrier functions. Okay, because the epithelial cells, the villi, are destroyed. Now everything that is in the content of the GI tract, all the GI tract content, has gained access now to the blood circulation, and that's how people can become, and horses, septicemic. Okay, so that's how Salmonella can gain entry to the blood circulation and cause systemic disease as well as diarrhea. So it starts with diarrhea and it can cause septicemia and kill the animal. Okay. During this time, we're going to have epithelial necrosis, okay, which is going to result in loss of serum protein into the lumen, which is lumen of the GI tract, which is going to lead to hypoproteinemia, which means low blood albumin in the blood. Okay, so that is going to become a problem because now the blood doesn't have all the colloid osmotic properties that a normal blood with correct amount of protein would have. Okay, this is the other problem too. Salmonella is gram-negative, and gram-negative bacteria has this thing here that's called endotoxins, and when they die or when they multiply, these endotoxins get released. Okay, so remember I talked about tetanus. They have exotoxins, which are released when they are still alive. Endotoxins are released when this bacteria died and their cell walls break, or when they are multiplied because their cell walls break as well. And endotoxins can actually kill an animal. Okay, so we're going to have effects on cardiac function. We're going to have fever, leukopenia, coagulopathies. This is a big thing in endotoxemia, which we're going to study in the next, I don't know, maybe 3 video recordings. It's going to be about endotoxemia, hypotension, and this animal can actually die because of this toxemia. And like I said, it can also cause septicemia because that barrier in the gut has been breached. Okay. Clinical signs, like I said, we're going to have the silent carrier, so these horses that are healthy but are shedding the bacteria, and then we can have a variety of clinical signs. We can have mild, we can have severe, we can have all the way to death. Okay, so we can have fever, decreased feed intake, loose stools, and we need to differentiate between, other respiratory diseases, even though this is GI tract, because this horse may not, they just have loose stools, they don't have a lot of diarrhea. And then we can have severe acute diarrhea with fever, colic, anorexia, dehydration, liver and kidney damage, okay, laminitis. That's a huge thing when a horse is toxic. Anytime a horse has diarrhea, laminitis can be a problem, okay? And if the horse doesn't die of the diarrhea, they can actually die because of the laminitis. So that is important for all of us to understand. Septicemia, I already talked about that. If the mare is pregnant, she can abort, and it can lead to death. Diagnosis and treatment. We can have, it's hard to diagnose Salmonella, okay? You have to have multiple negative results to be able to rule it out. You have to differentiate it between other reasons for diarrhea, including coronavirus, including E. coli, and other forms of colitis, okay? So we can have false positives and false negatives. False positive would be a horse that's having, we test its feces and has salmonella in it, but actually it's not the salmonella that's causing the disease, okay? That's a false positive. It is shedding salmonella, for sure, but it is not the salmonella that's causing the disease. So now you start treating for the salmonella and the horse doesn't get better because it is, not the cause, the main cause of the disease. Treatment, it depends, okay? Fluids, definitely Benamine for pain, and to also because Benamine is a endotoxin scavenger, okay? So that's important too. Steroids are contraindicated because they also can lead to laminitis, and remember, this disease can actually lead to laminitis itself. And nursing care, obviously, making sure the horse is eating, giving him palatable foods, making sure, that he is, his fever is okay, he's comfortable, maybe take him for walks, etc. Okay? But here's the thing that is a little bit difficult, is the problem with antibiotics. So this is a bacteria, but if we, in the beginning, we're going to kill the bacteria, we can actually, a horse that was not toxic can become toxic with this massive amount of bacteria that all of a sudden starts to die, okay? So the use of antibiotic is generally used in animals that are at risk for septicemia, so animals that are not responding to these other guys that we just talked here, okay? So that is actually a little bit of a problem because, ideally, you want to treat with antibiotics, but you just can't all the time. So that's what I said, that antibiotics can be used in case the animal is actually not getting well with the rest of the therapy, okay? Let's see. How do we prevent? So to prevent a salmonella in horses, we would have to quarantine the new arrivals, especially those coming back from a hospital. So a hospital that a horse that has been in the hospital for, say, several days and has possibly been in contact with salmonella, even if he doesn't get sick, he can actually spread the disease to other horses. And if you have another horse that is more immunocompromised or has other problems going on, he can actually get sick from being in contact with the horse that's shedding the bacteria. And obviously cleanliness, avoid overcrowding of pastures. Why is that? So horses are not eating feces, or hay that is too close to feces. Obviously, we're talking about pelletizing food. So if you feed pelleted feeds, it's more chance that the salmonella has been destroyed. We already talked about these guys here, that rodents and birds have no place to live in a barn. And you guys know what I am all for, to maintain a barn being rodent and bird free. And there is no vaccine available. And this is what's important, is that it can actually be a zoonosis. Because this is a fecal oral route, it is not species specific. A horse that is shedding salmonella and you are mucking the stall, or you are cleaning him up, or if it's a foal and you're trying to wash his little bottom, to remove the feces, and you don't wash your hands really well, or don't wear gloves as you're doing this, and then you eat or you touch your mouth, like I said, it's fecal oral route, you can actually get the disease yourself. So that can become a problem, because even though it is not species specific, it can actually, hold on just a second, this card, it can actually be a zoonotic disease, okay? And the same thing, it can pass from chickens to you, it can pass from hogs, cattle, etc. to you. So this is the Salmonella, and later on we are going to be talking about Lawsonia intracellularis. Good luck, guys.